Hello everyone, this is MBBS Gallery, and today our important topic is about joints. I have taken this from a general anatomy topic actually. So we are going to learn about what are the joints and functions and types of joints, and among that their articulations, their functions, their type of joints are going to be discussed in this video. So first let us start with an introduction on the function. So what is joint? So joint is a junction between two or more bones or cartilages. It is a device to permit movements. So what are all the uses through the joints? The joints transmits weight from body to the ground, and the joints of larynx helps in the speech, and the joints present which makes the thoracic cage helps in the respiration by making movements across transverse and the vertical direction, and joints helps to form a cavities, examples cranial cavity and thoracic etc., which are formed by the joints. So let us see about the types of joints actually. Here we are classifying joints according to four criteria actually. So according to structural, it is classified as three: fibrous joint, cartilaginous joint and synovial joint. So functionally it is classified into synarthrosis, amphiarthrosis, diarthrosis, and regionally it is again classified into skull type, vertebral type and limb type, and according to the number of articulating bones it is classified as simple joint, compound joint and complex joints. So these are all the classifications according to four criteria. So first of all, the fibrous joints in the structural type. The fibrous joints has sutures, syndesmosis and gomphosis types. And cartilaginous types has a primary cartilaginous asynchondrosis and secondary cartilaginous asymphysis or amphiarthrosis. So there is another joint called synovial joints, the functionally it can be classified into synarthrosis, amphiarthrosis and diarthrosis. So synarthrosis, which means immovable joints, and amphiarthrosis, which means slightly movable joint, and diarthrosis means a freely movable joints. So synarthrosis has examples such as sutures of fibrous joints which are immovable one, and the amphiarthrosis, which is slightly movable, is example a secondary cartilaginous joint, and diarthrosis, which is a freely movable, example synovial joint. So regionally it is classified into three: that skull type, which is immovable, and vertebral type, which is slightly movable, and limb type, which is freely movable. And according to the number of articulating bones, the simple joints, which means when only two bones articulates, example interphalangeal joint, that is a fingers, and then compound joint, more than two bones articulates within one capsule. This is one capsule. So example elbow joint and wrist joint. The remaining type of structural and articulating type of bone are here. The first one is a structural, the third type is synovial joint, so which includes ball and socket or spheroidal joint, and cellular or saddle joint, condylar or bicondylar joint, ellipsoidal joint, hinge joint, pivot or trochoid joint, and plane joint. These are all synovial joints present in our body. And the third most type, according to the number of articulating bone, is a complex joint, which is what is actually the complex joint? When joint cavity is divided by an intra-articular disc. Here is the intra-articular disc which separates the joint cavity. So it tends to form a complex joint. Examples are sternoclavicular joint, which is a joint between sternum and the clavicle. And another example is temporomandibular joint, which is present in between the temporal bone and the mandibular bone. So this is temporomandibular joints. So here this is a male part and this is a female part of articulation surface, and this joint cavity, which is got separated by a disc called intra-articular disc, and it's filled with synovial membrane, articular synovial membrane, and this is gonna be the capsule. This is type of a complex joint. So let us see about a fibrous joint a little more clearly here. So the fibrous joints is actually the joints which is formed between the bones by a fibrous tissues. So these joints are either immovable or permits a slight degree of movement here. So the fibrous joints is actually, we know that it is of three types: the sutural fibrous joints, syndesmosis, and gomphosis type. Sutural, syndesmosis, and gomphosis types. So this sutural fibrous joints is going to be which is present only in the skull. So two bones are separated by connective tissues, and sutures are peculiar to the skull and or immovable one. So according to the shape, we have a few types of sutural fibrous joints. That is plain type, which is present in internasal sutures, and serrate type, which is present in the interparietal sagittal suture. So the third one is the squamous type of sutural joints. Example is temporoparietal sutures, and denticulate type of sutural joints. Example is lambdoid suture between parietal and occipital bone, and scindellisis. Example, upper border of the vomer and rostrum of the sphenoids. These are all the sutural type of joints. And the second one is the syndesmosis. So this is actually a fibrous union between bones. This is actually the fibrous union between the bones. It may be represented as intraosseous ligament. So the intraosseous ligaments, as in case of inferior tibiofibular joints. So this is all about the syndesmosis. And then finally gomphosis. It is a peg and socket junction between tooth and its socket. So gomphosis is a peg and socket type of junction between tooth and its socket. Examples: periodontal ligament connects the dental element to the alveolar bones. This is all about the